just also to put a proviso, but with my current hat on as chair of the PAC, I have to, which is a sort of cross-party committee, which always has unanimous recommendation. We always reach our recommendations in a unanimous way, in public at least. We're not a committee that looks at policy decisions, so I've just got to say that we are a committee that focuses much more on just value for money of how the executive take forward their policy intent. So that's the limits of my position. So, but I'm going to say a little bit personally about really my experience as a minister and my experience as a Labour MP for another part of East London, Barking and Dagenham. And I just want to talk a little bit about my minister and the sort of context in which you're going to be taking these proposals forward. I think as a minister, I was always frustrated that we couldn't actually turn the tanker of public expenditure in whichever department I was involved in. We couldn't turn that massive tank around to ensure that more expenditure went in the early intervention and prevention agenda. It was always fantastically difficult. And you were always limited by money available. And that was true in the growth years. It's going to be far tougher in the years of public expenditure constraints and cuts. And the imperative always, particularly in sort of social policy type departments, was always to deal with the immediate crises. So, you know, take anything, take health, which I think is a very good example. It was responding to people as they had heart attacks to make sure you kept them alive, rather than thinking what action could you take to prevent them ever having a heart attack. And one of the very early reports we did in the PAC was looking at health inequalities, and I think there's some lessons to be learned out of that. Labour government comes in, 97, says, we're going to do something about health inequalities. We looked at this in 2010, just after the last election, and it was a depressing picture of inaction over those 13 years of government. Good intent, not translated into effective action. And indeed, 10 years, actually, as you looked over that sort of whole 13 years of government, 10 years when really the only action was further target setting and further policy papers with very little change on the ground. And there were such simple things that people could have done. There were 3 interventions that we looked at, which was, you know, smoking cessation, surprise, and 2 others were around statins and cholesterol drugs that you could take to prevent heart attacks. 3 simple interventions. Everybody knew they worked. Everybody knew that they could have actually reduced death through heart problems, and they just didn't happen. And actually, it took, I think, until 2007 before even targets were set in a very clear and specific way, which might have got the NHS machine turning round. And one of the rather interesting things, and ministers in that health department all absolutely committed to early intervention, early action, call it what you like. Yet by the end of 13 years of Labour government, we'd only managed to increase expenditure, the totality of expenditure on NHS, only 4% went on early intervention, and I think that grew from 3%. So there was a 1% increase in that whole 13 years of government. And I end that little health story with something about my own constituency. I do annual meetings with my GPs, who aren't the greatest in the country. And I remember having a meeting with them just at the time Labour was taking an initiative around smoking cessation. Given pills, you had to go back to your GP every 3 months or so for them to check that you actually were not smoking. Perfectly sensible initiative. And the GPs were moaning to me about how much work that entailed because they had to keep seeing their patients, their smoking patients, every 3 months. And I said, well, at least it means we're getting less emphysema and lung cancer if we can actually stop people getting smoking. To which one GP, in all seriousness, turned around to me and said, that's all very well, but they then end up with Alzheimer's, and that's even more work for us. So live longer and have other problems. It is a scandalous but true story. What that all brings you to is that the pressure is always, particularly particularly the NHS is a good example, from all the clinicians to deal with the crisis rather than to deal with prevention. And I have to say to you that much as I wish you well, I think in an environment of cuts, that pressure is going to be greater, not less. And therefore the task of translating this excellent report into practice is going to be more difficult, not less difficult. The second issue I want to say from my experience is that it's always terribly tough to prove value for money out of all these early action programs. Because what you're trying to prove is a negative, i.e. intervene early and something doesn't happen or something. It's a tough thing for Treasury to do. And I remember recently being at an event where we were talking about the history of Sure Start, where actually some of the academics said to us, one of the mistakes you made was rolling it out too fast, which may have been true, and not waiting for the evidence to prove actually that the interventions that we were trying to implement were effective. Had we not rolled it out fast, we'd never have ended up with a Sure Start infrastructure, which even in these times of cuts and scepticism about that early intervention, people are now finding it very, very difficult to cut. So it's this, waiting for the research evidence to prove that early intervention works, I think is a bad thing, because you can all go with our guts. It's such common sense, and it prevents action happening. And also, particularly with Treasury. Treasury is an absolute, throughout my years in government, and I was a minister for most of the years of the Labour government, you put a proposition to Treasury saying, if you pay now, you'll save later. And their scepticism around that proposition was endless, and our ability to persuade them that this was a sensible way forward was tough, tough, tough. And around Sure Start, what is particularly depressing now is I think we're just beginning to see the impact of the most effective Sure Start programs. We might have done things wrong, but we did a lot right in bringing around Sure Start. In my own constituency, we've had Ofsted come in and inspect our Sure Start centres, and the first 3 they've inspected have all had outstanding inspection results. What's happening at the level is they're all being cut by 20 to 30%, and a lot of those early intervention community development programs, working with parents and trying to get language development, or just the things we've been talking about this morning, they're the ones that are being cut, because things like child protection, dealing with a crisis, has to take precedence over the early intervention programs. So just as we're beginning to get the evidence, then get the cuts. So I think you've got a really tough task ahead. What can we do with the PAC, Public Accounts Committee? Our role is to hold the executive to account for expenditure and to secure value for money. We are very interested in the issues that you raise, because clearly if we can demonstrate the value for money of those early action programs, I think we might have an influence. Just this afternoon, I'm having to leave here because I've got to get myself ready for it. We're looking at a completely different issue, of flood relief, where the Environment Agency are saying quite clearly, 1 in 6 homes in the country are susceptible to damage from flooding. Over £1 billion a year is the cost of clearing up after there are floods. The Environment Agency says that the only way even to stand still is to increase the expenditure on flood prevention. What's happening in reality is that their budget is being cut by 10%. So here is a ridiculous cut that is going to lead to greater expenditure down the line, with all the distress and destruction that comes to families' lives when their homes gets flooded. Another example of where early action would help. So I will take this away. I don't have the power to tell the NAO that they've got to do reports. I can have conversations with them, but the Controller and Auditor General in the end takes his own decisions as what he looks at. But increasingly we're trying to look at cross-cutting issues. I think this is a really, really interesting one, and I'm ever so grateful to you guys for having done the work, which gives us the basis on which perhaps to do some important work over the coming years to help this vital aspect of social policy.